give us an incredible opportunity to expand the reach of Georgia MemoryNet as we continue to develop and go forward. And so I think it's entirely appropriate that the team that has put together this series of remote meetings and to take the place of our summit, which had to be canceled. It's easy for people like me because I just do what our great team members tell me to do, show up where they tell me to be, and they tell me what I should talk about or shut up and not talk about. And so thank you to Michaela, and I don't know who all was really integral in putting this series together. I already gave Travis enough of a shout out about his GMNywhere cleverness. But I'm going to hand it over now to Nicole, who will introduce the speakers and for what is, I think, a very appropriate topic to kick off this series, given the level of stress that each one of us has been experiencing. So with that, I'm going to shut up and hand it over to Nicole.
Thanks, Dr. Law. Hello, everyone. I'm Nicole Wachter. I'm one of GMN's program coordinators. So thank you so much for joining us today. I'm really excited about this session, and I'm glad you're here with us. Before we get started, just a few notes about today's presentation. First, just please make sure that you are on mute. And second, we'll be hosting a brief Q&A session at the end of today's presentation. So throughout the presentation, please feel free to submit questions for that session via Zoom's chat feature, so I can read them off at the end. All right, so without further delay, I'd like to introduce today's speakers. First up, we have Drew and Brooke, who will be leading us in an interactive activity. Drew Dixon is a second-year clinical psychology graduate student and caring communities member here at Emory's Department of Psychiatry and Behavior Sciences. Brooke McKenna is a fourth-year clinical psychology student in Emory's Department of Psychology and is involved in the Grady Trauma Project. After the interactive activity, Dr. Jordan Caddy will be presenting additional information about the importance of self-care. Dr. Caddy is an assistant professor in Emory's Department of Psychiatry and Behavioral Sciences. She is also actively involved in embedding mental health education and services in college, graduate, and professional school contexts. So thank you so much for being here with us today. So go ahead and I can share the presentation on my screen if that's easier, or you should be able to request on your end.
Drew and Brooke, would you like the slides up during your presentation? Or should we just get started experientially first?
We can just go ahead and jump right in, that's fine. So thank you so much for having us. I'll be getting us started today by kind of letting us just settle in and practice mindfulness using an exercise we like to call a body scan. And so if, you know, wherever you are, you're able to just find a comfortable seated position, we'll just go ahead and jump right in for these first few minutes. And once you find your comfortable position, just beginning by bringing your attention into your body. If you're comfortable doing so, just gently closing your eyes. If not, just gently resting them on a place in front of you. And taking a few deep breaths. As you do so, just directing your attention to the feeling of each in-breath and each out-breath. And then moving your attention to scan your body. Noting any sensations that may be present. Maybe feeling the contact of your body with the floor or your chair. Sweeping your awareness through different parts of your body, and as best you can, without judging what you are aware of, just bringing attention to your experience. Not labeling it as good or bad, just as what is there. And then directing your attention up to your head. Notice any sensations that are here. Perhaps feeling the weight of your head as it sits on your neck. Or moving your attention to your eyes, your nose, cheeks, and mouth. Maybe noticing if there's any tension in these areas. Just gently relaxing them. Moving up to your ears, noticing any sounds that may be coming through them. And then moving down into the neck and the shoulders. Again, noticing any tension that may be present here. And seeing if you can bring gentleness to those areas. Then moving down to the arms, the hands, the fingers. Maybe first noticing your left hand and fingers. Maybe any textures that they can feel, or tightening your grip and loosening. And then moving over to the right hand and the right fingers. Bringing the same awareness, maybe noticing differences of the two sides. And then focusing on the chest. Noticing the gentle rise and fall with each breath. The stretching sensations and deflations. And then turning towards your back. Maybe noticing any aches or pains here. And again, just trying your best to acknowledge these without judgment. Just bringing a level of acceptance to that. And then turning your awareness to the abdomen and the stomach. Moving down to your butt. Again, noticing how it makes contact with your chair. Feeling the weight of your body and that support. And then moving gently towards your legs. Noticing how your muscles feel. Down to your feet. Noticing any tension or sensations there. Maybe wiggling your toes. Noticing temperature or anything else. And as you complete this body scan, just taking one or two deeper breaths and bringing a sense of awareness back to the body as a whole. Just noticing whatever is present in this moment. Feeling the energy of life flowing through you.
Okay, and staying in connection with the breath, we'll move into cultivating a loving kindness during this exercise. We all have within us this natural capacity for loving kindness. Our friendship that is unconditional and open, gentle, and supportive. Loving kindness is a natural opening of a compassionate heart to ourselves and to others. It's a wish that everyone be well. So we begin with developing loving kindness toward ourselves, allowing our hearts to open with tenderness. Allow yourself to remember and open up to your basic goodness. You might remember times you've been kind or generous. You might recall your natural desire to be happy and not to suffer. If acknowledging your own goodness is difficult, look at yourself through the eyes of someone who loves you. What does that person love about you? That may allow feelings of kindness to flow more easily. And as you experience this feeling, notice what it feels like in your body. Maybe you feel some warmth, a sense of expansiveness. This is loving kindness, a natural feeling that is accessible to all of us. And resting in this feeling of open, unconditional love, just let yourself bask in that energy of loving kindness. Beginning now to wish yourself well by extending words of loving kindness to yourself. I'll offer as guidance some phrases, and you're invited to alter these phrases and choose whatever words express your wishes toward yourself. May I be filled with loving kindness. May I be held in loving kindness. May I feel connected and calm. May I accept myself just as I am. May I be happy. May I know the natural joy of being alive. Now you can open the circle of loving kindness by bringing to mind someone who is dear to you, someone whom you care about and who has always been supportive, reflecting on their basic goodness, sensing what it is in particular that you love about them. In your heart, you feel your appreciation for this dear one, and you begin your simple offering. May you be filled with loving kindness. May you be held in loving kindness. May you accept yourself just as you are. May you know the natural joy of being alive. Now bring to mind a neutral person. So someone you might see regularly but don't know very well. It might be a neighbor or a grocery store clerk. Bring this person to mind and repeat the words of loving kindness. May you be filled with loving kindness. May you be held in loving kindness. May you accept yourself just as you are. May you know the natural joy of being alive. And now, if it's possible for you, bring to mind someone with whom you've had a difficult relationship. Perhaps it's someone you don't like to feel sympathy or compassion for. Seeing if it's possible to let go of feelings of resentment and dislike for this person just for a moment. Reminding yourself to see this person as a whole being, deserving of love, as someone who feels pain and anxiety, as someone who also suffers. If it's not possible, just see if you can withhold self-judgment or self-criticism and accept where you're at right now. But if you can, you say to this difficult person, may you be filled with loving kindness. May you be held in loving kindness. May you accept yourself just as you are. May you know the natural joy of being alive. Now allow your awareness to open out into all directions, from yourself to the dear person, the neutral person, the difficult person, and of all beings, humans and animals living everywhere, living in richness, poverty, war, peace, hunger, abundance. Aware of all the joys and sorrows that all beings experience. May all beings be filled with loving kindness. May all beings be happy. May all beings be awakened and be free. May all beings be happy. And now, bringing this practice to a close, just come back to extending that kindness to yourself. Sensing the energy of loving kindness that may have been generated in this practice. And that concludes this practice for today. I'm gonna pass it off to Dr. Caddy now. Thank you.
Thank you, Drew. And thank you, Brooke. I will share my screen here and let me know if you can see it.
That's perfect. Thank you.
Okay, great. Well, we thought we would, Dr. Rachel Amorati and I have prepared some resources for us to go through together. But first we thought that we would talk a little bit amongst this group just about what people noticed and what people might have experienced as they were going through these experiential practices. Later we'll get to, a little bit of an outline of what is self-care, how do we define it, why is it important, what are some barriers that we often experience, with some kind of practical options. But I'd love to hear from people about what you might have noticed during the exercises, anything that surprised you, and any difficulty that might have come up.
Well, I'd be happy to start off. This is Nicole. I noticed that it was really difficult to quiet my brain and turn off kind of all of the external thoughts that are just kind of pinging around in there. So that was kind of something that was unexpectedly challenging.
Thank you, Nicole. So you noticed that your mind was very busy, that when you were trying to anchor your attention and to walk through these steps, that your mind had other plans for you and other things that wanted to be thought about. Love to hear from other people as well.
I put it in the chat, but the part that I had trouble with is the accepting both myself and others as they are, because I think personally, I like to think that I strive to be better, and I hope that others do as well.
Mm-hmm. So sometimes the word acceptance can be bring a lot to mind. Is acceptance resignation? Is acceptance only what is? And so we think a lot about this when we use these types of exercises about this balance between acceptance and change, kind of along the lines of what you're mentioning. It sounds like you're someone who identifies with a desire for growth and for change and for development, and so acceptance might feel a little static. And when we use it, we usually are referring to just the tendency for judgment or expectations, requiring ourselves to be different than we are right now, can kind of impair our effectiveness, right? So if we are, let's say we're a performance athlete and we're wanting to perform our best, and we have sore muscles, and we don't respond to those cues. We don't meet ourselves where we are immediately right now. We might do the workout that we hoped to do, that we expected to do, that we planned to do, and we might develop an injury as a result. And we notice that there are many ways that the same pattern might play out. So tuning into areas of difficulty or areas of just present moment awareness can give us information about how to adapt and how to be kind to ourselves, but also usually that means enhancing our performance to the extent we can in that moment. Other people, maybe one more perspective.
Hey, this is Travis. I just noticed that I had been trying to sort of perform some mindfulness stuff months ago, and it seems to have gone away recently. And that was just a nice reminder that, like, oh, just because everything's crazy right now, it's not necessarily a time to stop being mindful.
Sure. Thank you. So it was a reminder, or it was kind of a maybe a familiar place to land for a little bit. And I think that these exercises are such a great introduction for us as we kind of, as we're kind of thinking about self-care in general, because self-care can look really different. It can look like a lot of different things. It can sound like a lot of different things. And both of these, they had different areas of focus, different ways that, that they were directing our attention. But really, it's about stress relief and supporting our health and well-being. So anything that kind of promotes psychological and physical well-being, we could have done any of a range of different exercises that are accessible during a kind of a workday vibe, and we would have been in line with this definition. Oops, this only wants to happen one way. Okay. It's really important to think about self-care in general, but it's particularly for healthcare professionals, and particularly during a time like now, when we have major constraints, when we have major stresses, when we have major challenges in healthcare. And we know that burnout and lack of self-care among healthcare professionals has impact on patient care for patients and actually patient outcomes. So we're able to see ways that investing in self-care, kind of putting your own oxygen mask first, really does improve the quality of the care that we're providing as individuals and then as teams and settings. We also know that that healthcare providers who do promote their own self-care in a proactive way tend to be more self-compassionate, along the lines of our second exercise, more stressed and more satisfied. So we can kind of think about how not only are we wanting to, of course, care for ourselves in general and care for ourselves so we're performing well and treating others to the best of our abilities, but we're also hoping that our self-care can improve our everyday quality of life. And when we work with students on this, a lot of students say, I don't want to be less stressed. I just want to do better in school. I want to get great grades. And what we can say to those students, and what we say to the doctors as well, and all the other healthcare professionals we work with, is those are the same thing. So doing well and feeling well often go hand in hand. So when we are performing our best, when we're in that flow, we're typically, when those are the times that we're actually more engaged, we're more present, we're more able to perform at our highest level, and we're also enjoying it more because we're kind of thriving in that moment. We're providing great care. We're doing what we're there to do. And so, especially right now, in the context of COVID-19, we have a lot of moral injury, just seeing the healthcare system perform in ways and kind of fail in some ways that are really disappointing and kind of clash with morals and values that people have entering healthcare. We have a lot of burnout, and we have a lot of compassion fatigue. And so what we're thinking about is there are a million barriers to implementing self-care on a day-to-day basis. A lot of people in the ICUs, we're doing our team members in caring communities are doing different breaks, and they're saying, I can't do a 5-minute. I can't even listen to something like this. I can't do this during the shift. And so different people are finding different ways to, in the elevator on their way in, just bring themselves back to a place where they can be aware of what their heart rate is, be aware of the stress that they're carrying, and being aware that they're being responsive to their own needs in these different moments. So we're finding ways to kind of implement everywhere. Interestingly, a lot of barriers to self-care involve our internal barriers. They're about beliefs. People might feel it's not important, or it's kind of this optional thing that you do after your to-do list is done. Some people feel like they don't deserve it, or they're not allowed to do self-care. They're not allowed to take care of themselves first because they've got all these other competing priorities. My dogs will participate. Sorry about that. They also might have limited free time and role conflicts, jumping out of work vibes and into everyday family and friends. And also, one of the things that happens a lot with self-care in terms of exercise, but also self-care in other forms, is not really recognizing that self-care can include tiny moments, tiny activities and exercises. So exercise isn't just when you change your clothes and go to a place and do a specific thing for half an hour or an hour. Exercise is moving around, and so we can access that, and we improve a lot of health outcomes in robust ways when we make tiny changes throughout the day. And similarly, self-care can look like that too. And so people can be much more successful building in self-care when they define it more broadly. When they recognize that self-care can include both internal practices and external practices. Anybody on this meeting today could pop in some earplugs and do an exercise, or set aside some time. And it's something that we can do invisibly. It's something that we can do anywhere. Okay. Oops. Here we go. This is not trying to work for me today. There we go. All right. So, bearing in mind that self-care doesn't really have to be this huge thing, that small self-care activities can make a big difference. A couple of the things that we try to do first is, one, do experiential practices to sort of illustrate that there are lots of different options. They're really accessible to anyone. And we like to think about with different people, what thoughts or beliefs do you have about self-care that might be getting in your way of doing more of it? About not having time, about kind of running from moment to moment. Maybe everybody could just take a few seconds here to reflect about maybe what some of those barriers might look like or might sound like to you. And maybe one or two people could share maybe what one of their self-care barriers sounds like, or a reason that their mind comes up with that might prevent them from accessing a self-care practice.
For me, it would be trying to take care of my family, since I have 4 kids that range from age 15 to almost 6.
Mm-hmm. Mm-hmm. So you've got this array of people whose care you're really involved in. And so it sounds like maybe in those kind of prioritizing all of those folks maybe before your own self-care, do you notice any of those barriers around the small practices not getting scheduled, or if they're your high-level priorities, do you feel that they're also preventing you from doing these smaller things?
Not necessarily, but I think definitely scheduling them in your day is a way that you don't forget about them.
Absolutely, absolutely. And I think you bring up such a great point that I think is really important, which is that if you have this, finite amount of headspace or attention, and you've got all of these people and things that you're actively thinking about, that means that you're not actively thinking about other things. And for a lot of us, that can be, self-care can just get on the bump list and just not quite factor in or not have a place. Or not have a routine that it gets paired with. Maybe one more person, would you like to share a barrier that comes up for you?
Sure, I have the tendency to make it a thing, right? So I'm going to take care of myself. I'm going to go for this run at, dawn, and it's going to be these many miles, and I'm going to do this kind of stretching afterward, and it's going to be a scheduled thing. And then if anything comes up to mess with that schedule, then that thing is kind of not only out the door, but then the whole rest of the day feels a little bit off and turns into just work. And so having this reminder of, like, you can just take a couple minutes during the day and do that internal care and not necessarily make it a thing, I think will be a helpful thing for me to remember and do better at.
Sure. I love that example too, because it's such a great illustration of what our minds love to do. It sounds like you even got excited about your self-care plan, and you were anticipating this great run, and you were going to watch the sun come up and watch it get bright. And then the more specific that we get, the more kind of like locked in to that plan we are. And so instead of maybe a more of like a spectrum of self-care approach, or ideas that, movement would feel great to me today. I've been really in front of the computer a lot. No matter what happens between this time and this time, or for this many minutes a day, I want to be moving. And so whether or not you have the chance to change, stretch, and do all of that fun stuff, it sounds like a lot of us do notice that kind of all or nothing, that we're either fully doing this entire practice, or we may not have kind of that time or bandwidth. Thank you so much for sharing some of those. And I think that I'm always struck by, when I'm talking to providers especially, how many kind of thoughts and beliefs they notice when they tune in about, I shouldn't need to do self-care, I should always be at my best, I can just push through. And so all of these things that may not serve them well in the long term, or may not help them to kind of fill up their tank and prevent burnout, can really detract from their ability to check in, notice when they are getting towards that kind of burnout level, and also to notice when you need some restorative activities, you need some space, or you need something to actively recharge. Because a lot of people notice that their different roles, that the structure of their lives are not letting, they're having to be really proactive, really specific about how they spend time. So numbing out in front of, a Netflix marathon might feel really amazing, but if that's your only kind of break or self-care, you're going to get both bored with it, and it's not going to be that restorative, or it's not going to meet that many needs for folks. And so kind of thinking about what different self-care practices might fit in different moments and in different sort of moods. So when we think about creating a self-care action plan, noticing what feels helpful, what feels, and when, and in response to what, and having lots of different self-care strategies that you can use. Sometimes we notice that our self-care might be more kind of weighted in one particular direction. So some people have a lot of energizing practices in their kind of regular routine, or that they know that they love. Some people have tons of relaxation practices. And when they are feeling maybe hypothetically, from a lot of work from home or a lot of screen time, they might actually be craving something that's much more kind of energy building, much more novelty oriented. And so the unique demands of the present moment can often really disrupt us and show us where what we're not prepared for, or where we might want to invest some time or some energy. And I want us to just take a moment to notice about how taking care of people always has a lot of these same challenges, but right now we're taking care of a lot of people without as many of our team members surrounding us in different ways than usual. We know that change is hard cognitively and emotionally, and we know that we're taking care of a lot of really stressed patients and a lot of really stressed caregivers. And so that can just increase the sort of emotional intensity, our desire to help, our feelings of the difficult feelings when we can't resolve all of their concerns, or when they're struggling with these big things that are outside of our purview, when we're worried about somebody. And so one of the things that we thought we'd bring in today is noticing that in a time when we're maybe more likely to have heightened emotions, a lot more emotional intensity talking to us maybe more frequently throughout the day than we're used to, it can be nice to notice that emotions are trying to help, and that they can be a guide for what we do and don't do, and that different emotions are providing different information. And so we have a couple practices here, but we want to just validate for everybody who might be experiencing more fear or anxiety, more sadness, or just feeling blah, more anger, frustration, and more feelings of guilt, or I'm not doing this right, or some of that moral injury that we're feeling. So we have a couple practices that line up with some of those internal practices we mentioned before, to think about how we can use self-care even without taking additional time. Sometimes it's changing what we do in response to an emotion when we notice it. So really quickly, we can do some practice self-validation. And this just means that instead of pushing an emotion away because it's difficult or it's uncomfortable, we're struggling against it, trying to make it stop, saying, I shouldn't feel like this, there's nothing to be stressed about, I've done this before, I shouldn't feel this, I should just be able to do my job. Well, that doesn't work. And so if it did, you could do it. Since it doesn't, we're gonna try something else. It's really effortful to fight against a feeling that's already in your brain and it's already in your body. So instead, what we can do is sort of cushion the landing of that emotion. We can just name it, we validate it, and then we decide what to do with it or about it. And those tiny little steps, those little decisions often involve self-care practices. So to self-validate an emotion, all you have to do is notice. Let's say you are feeling anxious. Let's say you can answer the question for yourself in the context of my life and experience. Why does anxiety make perfect sense right now? And what that does is just notice that in context, almost any difficult experience or difficult emotion makes sense. It's there for a reason. It's telling us something about our environment. It's telling us something about ourselves. And so if anybody's feeling anxious, seeing their schedule full of new things, full of different things, full of additional commitments or additional responses, that makes a lot of sense to feel anxious about how are we going to fit this in? How are we going to get all of this done? And so then we do part two, which is just, given that anxiety is here right now and this makes sense, how can I care for myself, right? And maybe that has to do with setting a limit, putting on some music in the background. We can do these tiny things that just say, yes, I'm stressed. Yes, this makes sense. And what are my options? What tiny choices can I make about how I approach my day? Maybe I move a couple things to batch together similar tasks so I have to do less switching. If I've got to do all this, maybe I can do it efficiently by kind of separating things out or arranging them a little differently. And we might be able to make small choices that make a big difference. So again, the upshot of self-validation, just saying that if you're feeling, no matter what emotion you're feeling, we ask ourselves, why does this make perfect sense? Usually we see multiple reasons why it's there, and it's valid, right? And then in doing that, just naming it and validating that it's there, usually we see emotional intensity kind of go down just a bit, usually about a third when they look at it in studies. And then by choosing how to respond, sometimes the emotion doesn't need a separate response, but if your body feels stressed, you can take 3 deep breaths. You can just help your heart rate to come down just for a moment before you go in with the patient, before you move on. And so we can kind of gently care for our body or our minds in these small moments. The next one has to do with, similar to the exercise that you worked through earlier, self-compassion is just a different way to think about hard things. So compassion just refers to what we do with pain, whether we judge it, struggle against it, or whether we respond skillfully and flexibly. And building self-compassion skills is an incredibly worthwhile pursuit, especially right now, because basically all of the outcomes are positive and all of the side effects are good. And so psychiatric symptoms go down, self-reported stress goes down, quality of life goes up when we respond to challenges in this similar way. So we can kind of take those the skills we just thought about and do a self-compassion break. We can just notice, name the emotion and the pain. This hurts. I feel really stressed. Instead of what we usually do in our minds when we feel something that's difficult or uncomfortable, we often kind of isolate ourselves or personalize those feelings. We might say something like, I shouldn't feel this way. This is me being terrible at this one thing. It's coming up again. I always fail in this way. We might judge ourselves. It's all about me, right? I'm really personalizing this. Common humanity is a different way to think about pain, which is just that everybody has it and it's part of being a person. So how does this pain that I'm noticing right now, that makes sense, that is valid, and it's happening, how does this connect to my experience of being a person? Everybody who learns a new role, who gets a new job, who gets a new responsibility has difficulties at first. Suddenly, the pain is there, but it's not all about me and it's not this personal thing. This is just, it's here, but it's normal and it's part of being human. That last piece is this micro moment of self-care, this self-kindness, this offering ourselves understanding and kindness. And so self-compassion and self-validation are these sort of related skills that can go really, really far in increasing our patience, in letting ourselves learn and be flexible. And this website that I listed here, selfcompassion.org, is packed with different exercises, resources, and similar exercises to the ones you went through today. So those are particularly soothing. I'm hearing a lot of people are using those to fall asleep these days. So there's a lot of different organizations who have compiled special lists of self-care practices for specifically for COVID that are really responsive to some of the challenges and constraints that we're experiencing recently. And a couple that I've included here, and hopefully we can share the slides with everyone, are a couple of resources that the Unified Protocol has a lot to do with what we sort of thought about with emotions are sending us messages. They're helpful. Let's tune into them and use them differently. The Caring Communities pulled together tons of different psychological wellness guides for different folks with different experiences. So folks with kids at home, there's a guide specifically for that. College students who are having a lot of difficulty in kind of transitioning to being home for this semester, for the summer. Folks who are doing shelter in place alone and having more time that they're not as connected as they're used to being. Lots and lots of tip sheets for different strategies, different resources, all kinds of free stuff to practice. Here's, because the first one I mentioned, I'll just share this because the website was actually down. So this is one guide that uses different emotions. This is really fun today. That uses different emotions as a guide for tuning in and to being able to make helpful decisions about emotions. So even when an emotion comes up, which is gonna happen a million times a day because you're all people, we can respond in a more caring and a more effective way. So this like these like micro self-care moments. And that is all I have for us. So we have some time. I think that the goal was to have a little bit of time for discussion, for any kind of questions or concerns.
Yeah, thank you so much. This presentation was fantastic. And I'm looking through the Zoom group chat, and it's filled with people saying how needed this was and how much they appreciated it. So thank you all for being with us today. I've got a couple of questions that I wanted to share with you all. So what advice do you have for someone who's just starting out trying to embrace mindfulness more in kind of their everyday life?
That's a great question. I would say that some of the most helpful ways to think about mindfulness are, noticing that you can do a guided practice like the ones that we went through today, where there is someone who's kind of guiding you through the whole thing. So you don't have to kind of sit on a cushion and then set aside 45 minutes. That's pretty hard. That's like the black belt of mindfulness. But one of the other ways to practice is by doing anything that you, that's more tactile, that's more body focused. So a lot of people do a mindful walk, and they just have the goal of bringing their attention to what is happening right now. What do I see? How do my feet feel as they take each step? Noticing your hands as they swing. What do you smell blooming around you? What colors are different? Just kind of soaking in these more tactile experiences. Other people take a mindful shower, and they really kind of like feel as they're like lathering soap. So you can mindfully wash the dishes. You can do anything. And so mindfully make a cup of coffee or a cup of tea, and those opportunities to bring attention to the present, just to the mug that you're holding. Those are really helpful to offload your brain from getting all of that attention. Sometimes your environment needs it too.
That's great. I have another question on my end, but before I kind of, go ahead with it, I wanted to open it up to the floor and see if there's anyone else, on the call, any question you have based on the presentation today.
I have a question. This is Joanna. I was wondering, and this may not be immediately related, but I know that a lot of us are working from home, and now there isn't so much barrier between work life and home life. And I guess I feel like I'm sometimes struggling a little bit to unplug from work in the evening, because I just feel like I'm always in my office. So do you have any maybe suggestions for that?
I do. I think that's one of the biggest transitions that we heard about in our different support groups that we were doing in the first couple weeks, is folks were right next to they were hearing all these pings, and they were right next to their devices. They were more plugged in, and the schedule was weird. So now, as we're sort of in a different phase, especially, a lot of people are reflecting on, what amount of, if we're going to be on screens all day, the overload is very real. So what's a helpful amount of news? What's a helpful amount of email checks, and do I need them? And kind of taking like digital vacations. So a lot of people will say, you know what, on a Saturday, this is how many I actually need. That's and feeling free to, in different times of day, based on your role and your responsibilities and who you care for and where, and saying, where do I have zero? Where can I can make this less? Or even as you're doing a task, not having your email in the background, just hammering and adding things to the list, right? So really kind of thinking about how we have all this information at the same time, and that's recipe for feeling overwhelmed.
Thank you.
Realizing I was on mute, that's embarrassing. Any other questions or comments from anyone on the call? All right. Well, I guess I have one last one, kind of a quick one for all of you, but what is your kind of favorite way to incorporate mindfulness into your day?
Were you asking the three of us or the whole
Yes.
group?
Sorry, I'm so sorry, you guys.
Gotcha.
Okay, good. You know?
I really love practicing the method that Jordan was just sharing in terms of things that I already do in my everyday life rather than feeling like I need to set aside a specific amount of time in order to go through a very structured one. So the two that I especially try are mindful toothbrushing. And then also I had realized, especially with everything going on, that my morning coffee was lots of news reading, which is, you know, important in certain doses. And so I decided that instead I would shift to mindful coffee drinking. So those are my two main ones.
Drew, what about you?
Yeah, similarly, Brooke, with the coffee drinking, that's something that I've tried to transition into being like, coffee drinking is just the time to be drinking coffee and not to be like stimulating my senses with other things at the same time. And I've also tried specifically in the last, couple of months to try the mindful showering. So it's kind of nice.
I love, I just typed it into the chat. One of my micro self-care breaks is just this app that does simple random reminders, and it just makes this little gong sound. It's really pleasant. And so it's not like the you have a task and you have messages. It's a very different kind of tone, and it'll just show up on your screen, but anytime up to, I think, 10 times in a day. And so just putting a simple reminder about something that you want to be thoughtful about. So one of mine just says, take an extra deep breath. And so every once in a while it shows up and I'm just reminded to check in with my body. And that's a really easy kind of no muss, no fuss, no stress kind of way. And other people are really enjoying, I've been kind of doing like at a specific time, like 7 o'clock self-care. Do any one thing for any number of minutes or seconds, and just kind of like having a built-in, this is a time that something should be able to happen, no matter what that thing is. Just having kind of that built in, because the tendency, I think, for a lot of us is just to run and run and run and run.
Absolutely. Thank you so much. That's really helpful. And thank you again for being here with us today. This was a fantastic way to start off our series. So we really appreciate it. Just a couple of reminders for everyone on the call. Our next session is next Wednesday, the 17th, same time. There will be an invitation coming out by the end of this week with a new Zoom link to use. Next week's speaker is going to be Jocelyn Wise. She's going to be giving us a presentation about how to support patients who come in and don't necessarily receive a dementia diagnosis, but maybe there's another factor in play like depression or anxiety. So I hope you'll all be able to join us, and I hope you have a great day. Thanks so much.
Thanks,
Bye, everyone.
Thank you, Nicole. And thanks, Nicole.
Bye. Thank you so much.